Kathy, as we all know, October is Breast Cancer Awareness Month, and here with more information for all of us this morning, Roz Makaula, Executive Director of the American Cancer Society, and Yisa Var, an American Cancer Society volunteer and a survivor. We're happy about that, as you are as well.
Yeah.
The Cancer Society is very focused on programs having to do with people who have cancer and ways to reach out to them and help them. Tell me about some of the programs, some of the efforts being made by the Cancer Society for those people with cancer or concerned about it.
Well, we have several programs available, and one of the programs that we really want to focus this month for Breast Cancer Awareness Month is our Reach to Recovery program. And what Reach to Recovery is, it's a program where we partner breast cancer survivors with a newly diagnosed breast cancer patient. And the survivors become mentors of sorts, information officers, and a resource to the newly diagnosed patient.
Did you have one of those, or are you one now?
I actually did have a Reach to Recovery partner that helped me. When you're diagnosed with breast cancer, especially so young, you don't know where to turn. The day after I was diagnosed, I went straight to the American Cancer Society office to get information, and they did connect me with someone with a similar background, somewhat young, similar breast cancer, and it was very, very helpful to have somebody to talk to. I didn't feel so alone, and also not emotionally involved, just knew the facts, was very trained, and knew what to say to make me feel better.
And in turn, have you been able to provide somebody else with that same kind of comfort?
I have not officially signed on as a volunteer, but that's something that I'm going to be doing very soon. I'm just past 1 year from my treatment, so yes, I get to do that. I cannot wait.
I can see where that would be just a tremendous help because it is kind of isolating. You know, when you first get that diagnosis, I can see where it would be isolating, and you know, along with all of the medical procedures, there's the emotional and mental thing involved in that as well.
Right.
Other kinds of programs that are effective in that way?
Well, the American Cancer Society also pushes early detection. So what we like to tell young women is to be aware of your bodies. Get your annual mammogram if you're 40 years of age or older. In the case of where Yisa and I were diagnosed, we were both diagnosed at 31.
Yeah.
And so our recommendation is to let folks in their 20s and 30s to do clinical breast exams at least every 3 years. And then if you have a history of breast cancer in your family, talk to your doctor, let your doctor know that there's a history, and then you'll be able to start your screenings much earlier.
Early detection for you, was that one of the helps along the road?
Definitely, and when you're so young, it's very, very hard to get that diagnosis because they want to see if it's other things first, because at 31, that's not the first thing they think is cancer, which I don't think I thought that either. So definitely early detection, push for your own health care, and be aware of your own body.
When they hooked you up with the, for lack of a better word, mentor or aid along the way, you could be open with that person and share your feelings, not just about the clinical part, the medical part, but everything else going on as well.
Oh, definitely. And it's all confidential, so I know that it's someone that I can trust, and I definitely cried a lot on the phone to her. I knew that if I got test results, she's the first person I called instead of calling a doctor or looking it up online, because she'd been there, she'd been through all of it, she knew exactly how I felt. So just to have that part out of the way, I felt instantly bonded.
And in a way, someone outside your immediate circle you have nothing else in common really except that would really have be a positive thing. They don't have anything invested in you except that particular connection, rather than a family member who would be comforting and solicitous, but might not understand exactly what you're going through.
Definitely. It's very comforting to have someone who just is there for me, and that's why becoming a volunteer is going to be so important to me, because I've learned so much in this that I can't wait to share that with somebody else and be on the other end of the phone for somebody.
Terrific. That's a very positive attitude, which obviously helped in your recovery. So.
Oh, yes. Humor is the key.
Thanks, Yisa. Thank you, Roz. Good to have you both here, and keep up the good work, and we'll encourage women, especially, as you say, in their 30s, to pay close attention to what's going on with their bodies. All right.
Thank you.
Thanks for being here.